What is the nerve supply to a spine that causes back pain and arm or leg pain? What is it? I thought that Moon did a good paper published in Spine Journal in 2012, a part of my didactic presentations, and it's called Annulus fibrosus cells interact with neuron-like cells to modulate production of growth factors and cytokines in symptomatic disc degeneration. In this paper, he discusses neovascularization of a disc, that is the ability of healing a tear, a degenerative change in the annulus fibrosus of a disc. And when you study that, you see that there is an anti-inflammatory reaction within the annulus and the tissues surrounding it that contain these cytokines like tumor necrosis factor alpha, various interleukins called cytokines. And the fact is that when a disc degenerates, the dorsal root ganglion actually sprouts sympathetic nerves into the annulus fibrosus of the disc. And as Moon points out, such nerve ingrowth and neovascularization is thought to be one of the major sources of discogenic low back pain and can occur as a consequence of local production of blood flow and nerve factors when you injure and tear the layers of the intervertebral disc. He goes on to talk about these cytokines, this tumor necrosis factor alpha, and the various cytokines that are produced by macrophages and monocytes as discs tear and become inflamed. And they include things like interleukin 8 and interleukin 6, which may be a part of the major inflammatory change in the disc that causes leg pain. So it goes on to point out that when we have disc degeneration and these nerves are exposed to these chemical inflammatory changes, that we see there's a direct link between the cellular tearing and destruction of disc cells, the neovascularization and the ingrowth of sympathetic nerves, the production of these chemical inflammatory agents that are associated with disc degeneration. So we are interested as chiropractic manipulating physicians in determining what happens when we do distraction manipulation. We know about increasing disc height. We know about promoting range of motion. We know about increasing foraminal area. We know about dropping the pressure inside the intervertebral disc and creating normal range of motion, which we know is important in order to have a successful outcome from any spinal manipulation.